enormously challenging, and there's no way in the world Congress is going to pass a bill that suddenly, transforms the healthcare system overnight. And if we had the composite bill that everybody here thought leaving here was the perfect bill, it would still be the burden of our doctors, our nurses, our hospitals, our insurance folks to make that thing work. And actually, I just want to say this in the beginning, because this is a source of real concern. And if I have one frustration in my job in Washington, it's that at the present time, it's very tough to get bipartisan cooperation on things that, in my view, for the future of America, require bipartisan cooperation. When we worked on health care in Vermont, we had a lot of strongly different positions on it. And basically, the Democrats were arguing we needed more access, and the governor was arguing we needed to contain cost. And I think at a certain point we understood that we were both right, that if you were going to get increased access, you had to deal with the cost side. And that, I think, essential wisdom is something that we need more of in Washington. But the other thing that I think was really important about having both sides in the end be able to sign on to something is that on something as challenging and difficult as healthcare, where in fact there are a lot of moving pieces and where there's consequences to doing nothing, we'd all agree. Is the current system sustainable? I think most of us would say no, it's not. But there's obviously consequences to what we do to try to remedy that, and we can make some decisions that are right and some decisions that are wrong. When you have something as important and as fundamentally intimate as healthcare, where it really affects people, if we have a bipartisan approach, then the American people, I think, have some confidence that we probably got it more right than wrong. Not perfect, but more right than wrong. And then they have some confidence that what we got wrong we'll be willing to make right. And that's eluding us so far, and it's disappointing. But it kind of goes to something that really inspired my talking to Joe about helping with a roundtable. He and I talked just, a couple of weeks ago. I think you had some concerns, but Joe mentioned to me that he really felt on healthcare there ought to be an ability on insurance, just on this one particular issue, for people to buy it across state lines. And that's been a big bone of contention in this state. It's been part of the debate. And I asked Joe, I said, well, wait, Joe, if we were selling it across state lines, would you think that there'd have to be some, in effect, consumer protection? So you'd have policies so that if you were a purchaser of a policy, you had some confidence that what you were buying met real health care needs. And Joe, I don't think I'm putting words in your mouth, but you thought, yeah, that makes some sense. Well, I agree in that case that what we should do is allow that to be an option, because then you get more competition with some consumer protection. You're combining some of the benefit of the marketplace where, in fact, you get to shop for the best and cheapest policy, but with some underlying confidence that the policy you're getting actually provides coverage. And this is in contrast, I'll tell you, some of the policies that get sold now, we had a hearing in Washington, these tend not to be so much Vermont problems. Cost is a real Vermont problem. We had a family that came in, and this man was paying insurance for 7 years. He was getting a catastrophic insurance policy, he thought, because that's all they could afford. Okay, so it was high deductible and so on. Well, he got a heart condition. He had to have heart surgery. So, the policy was there to help him, he thought. It turned out that this policy, and this was by Aetna, okay, this is an Aetna policy. Most of us would say is a pretty reputable company. They denied claims except for the cost of the overnight stay in the hospital. He was there for 7 or 10 days. So they covered like the room cost, like it was Motel 6, but they didn't cover the surgery, they didn't cover the nurses, they didn't cover the medication, they didn't cover all the things that you need when you go. Can you imagine that? I mean, if you did a heart surgery and the insurance just paid for the overnight room and not any of the other ancillary services that Southwestern Hospital. Well, see, that's, in my view, that's not right. So if you have some standards so that the policy that I buy or Joe buys, we know that when we go into the hospital it's going to cover us, then you have competition. I think that makes sense. So that's the kind of bipartisan sort of meeting of minds on things that I think make sense, and I appreciated Joe pointing out. But I want to open this up for discussion, but first, here's what the health plan is essentially about. It's three things. Okay, and with all the back and forth, it gets fairly confused, but there's three essential components. One is insurance reform, and it would say that anybody who wants to sell insurance can, but it would be through this exchange, and there would be standards, and there would be a basic plan, a somewhat basic plus, and a premium plan and a premium plus, all right, but they would be defined benefits that had a requirement that if an insurance company wanted to compete in Vermont or Kansas or wherever they did, they couldn't deny you for a pre-existing condition. They couldn't take your coverage away because you got sick, and that actually happens. All right, there'd be standards on copays and deductibles so that there'd be some encouragement for folks to get the preventive care that I think in Vermont has been a big concern for us. And there wouldn't be these lifetime minimums that most people have no control over. If you're afflicted with something that's a really serious disease and requires ongoing care, it's not because you wanted it, it's just because it's the luck of the draw. And all the insurance companies would have to abide by those rules, but then, in my view, they should be allowed to compete. Now, in order for that to happen, it would actually take some approval on the part of the General Assembly here. With the basic benefit package. So there's got to be and will continue to be a role for the state legislature. So there's number one, insurance reform. Number two is extension of coverage. Under the legislation that we have passed out of the Energy and Commerce Committee, 37 million more Americans would be covered. And that's good for them, obviously. I think it's good for your hospital as well, because those people showing up without insurance that you cover, you know, you're a Vermont hospital and you do what doctors do, you have to pass that cost on to Rolf's firm and everyone else. Right. And the statistics are that if you are paying full fare with the Blue Cross Premium or family plan, it's about $1,100 is your fee to pay for the uncompensated care for the folks who show up at Southwestern Vermont Medical Center. So that's the second element. And then the third element is the public option. And there's a lot of debate back and forth on it. I'm a strong supporter of a public option. Public option would be another choice for you or me. There'd be some lag in when this would be implemented. But it would be a plan that would have to compete in that same exchange I just mentioned that all the private insurance companies participate in, where they're subject to these rules. Can't deny a pre-existing condition. You can't yank coverage when somebody gets sick. You know, whatever the rules are there would apply to this public option. And that then, as an individual consumer, you would have the choice whether to go with Aetna or Cigna or MVP or Blue Cross or the public option, your choice. I support it because I think it would add some competition. And I got to tell you, I think the insurance companies and the insurance industry needs competition. I really do. I think they've been taking us for a ride. You know, when they're selling policies that don't give us coverage, or the head of Aetna made $24 million, or the head of Blue Cross Blue Shield here in our own state worked for 9 years and he left with a $9 million walk out the door package. I mean, I don't think that would happen in a public option. So those are the three elements of it. And having given that little introduction, I thought it'd be good to go around and hear from people about their concerns.